After greeting and identifying the patient and getting the consent for blood collection, position the patient and apply the tourniquet. Palpate the vein of the patient. After selecting the puncture site, release the tourniquet. Cleanse the puncture site in a concentric circular motion. Allow the alcohol to air dry. Reapply the tourniquet. Use one-hand technique in removing the cap of the syringe. Bevel up and puncture the site. Make sure to anchor the vein. Slowly pull the plunger. Release the tourniquet and slowly remove the needle from the vein and apply cotton with a plaster on the puncture site. Remember to observe fishing out when capping the needle. Then proceed to transferring the collected blood to the EDTA tube. Fill the tubes with their designated volume. Avoid overfilling and underfilling the tubes. After filling the tube, cap it and make the appropriate number of inversions. For the EDTA tube, make sure to invert the tube 8 times. Do not forget to label the tube with the necessary information. Remember to verify the patient's information. In performing the HBsAg test, prepare the test kit, the labeling pen, the timer, and the sample. When ready to test, open the pouch at the notch and remove the device. Place the test device on a clean, flat surface. Be sure to label the device with the specimen's ID number or the patient's name. Using the plastic dropper, dispense 3 drops of the specimen into the sample well, making sure that there are no air bubbles. Now set up the timer. Results can be read in 5 minutes. Patiently wait for the sample in the sample well to laterally flow to the cassette's test pad until a pink band or bands appear. At 5 minutes, read the results. The test kit device shows that only a band on the C region is developed. This means that the patient has no detectable HBsAg. It is interpreted as a negative result, which means the patient is also non-reactive for HBsAg as shown in the test. For the HBsAg test, bring the specimen and test components to room temperature. When ready to test, open the pouch at the notch and remove the device. Place the test device on a clean and flat surface. Using the plastic dropper, fill it with specimen. Dispense 3 drops of the specimen into the sample well, making sure that there are no air bubbles. Set up the timer for 5 minutes. Results can be read in 5 minutes. Now, you can read the labeled test cassette for HBsAg. Since both C and T bands are developed, the test indicates the presence of HBsAg in the specimen. The result is positive. This denotes that the patient is reactive in the HBsAg test. For the urine pregnancy test, prepare the test kit device, the labeling device, the timer, and the specimen. Remove the test cassette from the sealed foil pouch. Place the test cassette on a flat horizontal surface. Label the test cassette with the patient's name or the patient ID. Using the pipette, dispense 3 drops of the sample into the sample well. Set up the timer for 5 minutes. The results can be read in 5 minutes. Patiently wait for the sample in the sample well to laterally flow into the cassette's pad. At 5 minutes, you can already read the results. The results reveal the presence of only one pink-colored band appearing in the control region. This denotes that the patient is negative for the urine pregnancy test, which means the patient is not pregnant. In performing the qualitative determination of anti-streptolysin O, place a drop of the ASO latex reagent on this black cell of the glass slide. Then, transfer 50 microliters of the serum sample onto the latex reagent. Use an applicator stick to mix the reagent and the serum sample. Remember to spread the fluid over the entire area of the particular cell. Tilt the slide back and forth slowly and evenly for 2 minutes so that the mixture rotates slowly inside the cell. At the end of the 2 minutes, read the results under bright light. The results show no agglutination within the cell. Therefore, the patient is non-reactive in the anti-streptolysin O test. And using the mini VIDAS analyzer, prepare the serum sample, the SPR or solid phase receptacle, VIDAS strip, pipette, and labeling pen. First, pipette 200 microliters of serum and dispense it in the sample well of the VIDAS strip. Then, label the strip with the name of the patient. Once the VIDAS strip is all set, proceed to the machine. In assigning an assay to a position, select Status Screen. Select an available section for you to proceed. Press number 1 for the position where the reagent strip will be placed. Then, select Assay. Afterwards, choose Select Assay. Once the assay code list appears, select TSH as the test to be performed. In assigning a sample ID to a position, select Sample ID. Then, input the patient's last name. Afterwards, press the back button to return to the main menu. press the back button once more. Once the patient's last name is already assigned, load the VIDAS strip and solid phase receptacle or SPR into the machine in a parallel position. Once the strip and SPR or solid phase receptacle have been loaded, close the cover and click Start to run the sample. Once the machine has generated and printed the results, read and interpret it. It shows that the TSH level of patient Remorosa is 3.77 UIU per ml. Since the result lies within the reference range of 0.3 to 5 UIU per ml, this denotes that the patient has a normal TSH level. First, label the tubes. For major cross-matching, mix 2 drops of patient's serum or plasma with 1 drop of 3 to 5% donor's red cell suspension. For minor cross-matching, mix 2 drops of donor's serum or plasma with 1 drop of 3 to 5% patient's red cell suspension. Afterwards, add 2 drops of LISS to each tube. After adding the LISS, do not forget to mix the tubes. Incubate the tubes at 37 degrees Celsius for 10 to 15 minutes. After the 10 to 15 minute incubation, remove the tubes from the incubator. Centrifuge the tubes for 15 seconds at 3,400 RPM. And after centrifugation, observe for hemolysis and agglutination by gently resuspending the red cell button. Grade and record results. The results in the immediate spin phase for major cross-matching yielded the same results as in the 37 degrees Celsius phase. The results in the immediate spin phase for minor cross-matching yielded the same results as in the 37 degrees Celsius phase. After recording the results for the immediate spin phase and 37 degrees Celsius phase for both minor and major cross-matching, proceed to washing the red cells 3 times with saline. Completely decant the final wash. Then, add 2 drops of AHG to the dry red cell button on each tube. After adding the drops of AHG on each tube, mix well. Centrifuge at 3,400 RPM. Then observe for agglutination. Grade and record the results. This clip shows that the AHG phase result for minor cross-matching is 2+, while a 4+ agglutination reaction for major cross-matching in AHG phase.